And good morning, everyone. Welcome to this week's Let's Talk About. And today we'll be talking about the work of a Master of Social Work student has been doing for seniors, with seniors in all, I guess, and their collective impact project. And before we move on, I just want to cover a few brief housekeeping items with you. And mute your mics, please, to block any outside noises. We have dogs and cats in some people's homes, and we need to listen to real voices today. See captioning at the bottom of the screen. There will be closed captioning for anyone who needs it. Any questions or comments you have, please put them in the chat box to go along. And this session is being recorded, as we record all our sessions to YouTube, as you know. And of course, as usual, if anyone requests if anyone would like us to do a session on anything in particular, please, by all means, let me know. And we will see what we can do about it. Now I'm going to ask Meg to do the land acknowledgement for us. Meg?
Thank you, Mary. We respectfully acknowledge the land on which we gather as the ancestral homelands of the Beothuk, whose culture has now been erased forever. We also acknowledge the island of Ukdahumguk as the unceded traditional territory of the Beothuk and Mi'kmaq, and we acknowledge Labrador as the traditional and ancestral homelands of the Innu, of Nitassinan, the Inuit of Nuntasivut, and the Inuit of Nunatuavut. We recognize all First Peoples who are here before us, those who live with us now, and the 7 generations to come. As First Peoples have done since time immemorial, we strive to be responsible stewards of the land and to respect the cultures, ceremonies, and traditions of all who call it home. As we open our hearts and minds to the past, we commit ourselves to working in a spirit of truth and reconciliation to make a better future for all.
And today's speaker is just completing her Master of Social Work placement here at Seniors NL. And it's been a real pleasure to have her working with us for the past few months. It's been great, Vanessa. In her presentation, Vanessa will discuss her Pathways project, which is literature review that focuses on the development of a volunteer-based program. It's referred to in the review as Nav-CARE NL, and it has not yet been implemented into the province, but maybe in the future. We hope so anyway. And the aim is to have a volunteer-based program to support older adults to remain at home through assistance with basic yet critical supports. And these supports include assistance related to activities for daily living, such as light housekeeping and food preparation, transportation, socialization, as well as any supports relating to systemic navigation to help people get through the different systems that they may have to work with from time to time. And I am very pleased now to present today's guest. Vanessa is currently, as I said, finishing her last semester of the Master of Social Work program at Memorial University. And during this last semester, Vanessa is completing her field practicum with Seniors NL and working primarily with the Collective Impact Project. The overall goal of the project is to create a single entry service system that can support seniors age 55 plus who are facing multiple critical issues impacting their health and well-being. And Vanessa is also employed as a frontline social worker with Newfoundland and Labrador Housing Corporation under their rental housing program. And she will be returning to that position at the end of this week. And once again, as we move along, you can put your questions and comments in the chat box. And now I will have Vanessa bring up her screen and get on with the presentation. Thanks, everyone.
Hi, everyone. Can everyone hear me? Good?
Perfect.
Good. Really good. Okay. So thanks everyone for coming. I'm going to talk a little bit about my Pathways project, as Mary had mentioned. And Pathways is basically a final research product that I've been working on throughout my MSW program. And it is a lit review. And it's titled Exploring Nav-CARE, a volunteer-based program assisting older adults to age well at home. And I want to point out the reason I say exploring Nav-CARE is because Nav-CARE isn't currently a program that's offered in Newfoundland right now, but it is my hope that this lit review could help support any kind of future development with that. Nav-CARE is implemented in other provinces, and it's actually originated in BC. So I'm going to talk a little bit about that original program as well. So yeah, I guess I'll just get started there.
Here and go on that computer.
I'm reading the captioning. Perfect. I didn't know when you were finished. I had forgotten to turn it on. Or...
So I'm just going to go over the agenda really quickly. First, I'm going to talk about the purpose of the literature review. The overall overview for the Nav-CARE program that exists right now in BC and I believe in other areas of the country. I'm going to talk about existing programs in Newfoundland with a system navigation component. I'm going to touch on some statistics, the key demographic that I think would benefit from a program like Nav-CARE in Newfoundland. And I'm going to talk about my research method, summarize quickly my research findings, implications for the development of Nav-CARE in Newfoundland, and I'm also going to make the connection between Nav-CARE in Newfoundland and the Health Accord, because I had the opportunity to review the blueprint and I was able to find a lot of different connections with that. And lastly, I want to leave some time for discussion, any feedback, suggestions. I'm currently in the ending phase of my lit review right now. I haven't completely finished it, and I know that there's a wealth of knowledge here today. So I would love to have any kind of feedback, suggestions, or discussion at all after the presentation. So I want to highlight the purpose of the lit review first, and that is to highlight a service gap that is impacting older adults living in Newfoundland. And this gap is a lack of proactive, lower level and system navigation supports for older adults that still reside in their home. And lower level supports in my lit review are defined as activities for daily living, such as light housekeeping, meal preparation, transportation, and socialization. And older adults seeking assistance with these types of supports alone often do not qualify under the Provincial Home Support Program because they do not fit the clinical assessment requirements, which mainly focuses on personal care needs. So I'm going to outline a way to address this gap through utilizing a volunteer-based program that assists with system navigation and lower level supports. And this volunteer program is informed by an existing program called Nav-CARE, as I had mentioned. And like I said, it's my hope that this lit review will aid in any kind of future planning or development of a program like this in Newfoundland. Before I continue though, I want to highlight that lower level supports, when I say that, I don't mean that in any way they are lower priority or indicate any kind of lower value. I refer to lower level because these supports often fall under what the health authority and assessments deem as, say, level 1 supports. So these types of activities would often fall under the level 1 assessment criteria. But I do believe that they're very valuable and essential. So I'm going to touch a little bit on the Nav-CARE program as it exists. It's currently operating in BC, and it uses volunteers, trained volunteers, as a connection between the health Authority, healthcare professionals, and families. And Nav-CARE volunteers work with older persons with chronic health conditions that are towards the end of life. Volunteers navigate the best fit for services based on the needs of the older adult, their families, and current community resources, with a focus on improving access to services and promoting quality of life. Volunteers focus on general social support, transportation, companionship, assistance in maintaining the home, meal prep, support with navigating multiple systems. And it is supported through a volunteer coordinator who's responsible for recruitment, supports with screening seniors and their families, and doing some matching with volunteers and seniors and their families. And for more information on this, I do have a link. Yeah, so there's more information on that if you'd like to learn more. So next I'm going to talk about some exemplars that are in our province right now that have a system navigation component. I think it's important to mention that there's a lot of great work happening in our province, but you know, there's also some gaps as well, and I think that this volunteer-based service could help fill those gaps. So I did touch on the provincial home support program, so I'll just briefly go over it. So it is one of several resources under the community supports program overseen by regional health authorities in our province. And the program aims to service eligible individuals who require assistance with tasks of daily living, to prevent delay or substitute placement in long-term care facilities by offering non-professional supports that assist with personal care, homemaking, respite, and behavioral supports. And eligibility is determined by an assessment from a social worker, or it could be a community health nurse as well, I believe. And there's also a financial assessment component. And I think that this program offers aspects of system navigation because once you're deemed eligible for the program, there is a social worker who oversees your file that could act as a navigator for the senior or individual receiving home care. And also there is a home care worker too. So having that in-house support could help be a first point of contact for any system navigation support. So I wanted to highlight that program. I also learned about a program called the Life Unlimited for Older Adults Committee, and it operates out of Springdale. And it offers volunteer support within the community to deliver cost-effective day programming in the absence of institutional resources found in larger urban areas. And the community partners with local regional health authorities to provide transportation, friendly visiting. There's a community kitchen, fitness sessions I was reading about, and some intergenerational activities. So I think that this is a really great example to highlight how volunteers can be used to fill a service gap, and also how they can be used for social prescribing activities as well, which I will chat a little bit more about later on in the presentation. Another program that I read about is the First Link program that's offered through the Alzheimer's Society. And this program works with individuals who have been diagnosed with early dementia in providing system navigation supports and early intervention. First Link offers a learning program series to individuals and their families that provide an overview of the diagnosis, coping mechanisms, and resource information, and partners with physicians to help ensure that individuals are referred to the First Link program after the initial diagnosis. So this is an example of early intervention and system navigation that I wanted to include. Seniors NL, through their information and referral line, that's a great system navigation tool that we have in the community. And this line is run by peer support volunteers. And also the Seniors NL website is a database of information that is geared towards the support for older adults, their families, supporters, and service providers. Also, the Seniors NL, through their Collective Impact Project, funded by the Pan-Canadian New Horizons for Seniors program, they use a no wrong door approach to help seniors with system navigation. And you know, often seniors are presenting with multiple needs and having difficulty accessing multiple services at once. So through, Seniors NL's collaboration with other organizations, they're working to streamline services through the oversight committee and interagency teams. And these are partnerships with other organizations and government systems that are also working to support seniors. So that's a project that I was working on a lot when I was here, during my time here, and I've learned a lot about system navigation and that broader level change that's super important. And Connections for Seniors, I also want to touch on this organization. They are a local nonprofit organization, and the mandate is to empower seniors to overcome barriers to safe and affordable housing and provide support services that help reduce risks to well-being and promote quality of life. And Connections for Seniors believes that all seniors have the right to feel safe, to feel healthy, and to make choices about their own lives. And this organization has a volunteer program that helps address social isolation and food insecurity among seniors. They also offer outreach services to prevent homelessness and address gaps in services, and work with government and community partners for a wraparound approach. And this organization also provides transportations for older adults related to medical and housing appointments. I think it's directly related to navigation support that way, because we're meeting older adults where they're to and offering assistance in filling the gaps and barriers that they're facing. Just some additional comments, based on my research, these are all excellent exemplars, but right now there are no mandated programs in Newfoundland that is solely focused in providing the proactive, low barrier and long-term one-on-one in-house support. These organizations are all providing excellent services, but they may only have 1 or 2 staff or volunteers to assist the needs of many. And this makes it really difficult to provide one-on-one support in-house. And depending on the needs of the older adult looking for the service, this could be multiple times a week. And I think that one-on-one individualized support is important. I wanted to just share some statistics really quick that I stumbled across during my research. 49.68% of the province's population is age 50 plus. Between 2016 and 2021, the portion of NL's population age 65 plus grew the fastest compared to the rest of Canada. In the 2016 census report, it states that Newfoundland has the lowest life expectancy, compared to the rest of Canada. And I want to touch on the key demographics that I think would really benefit and could avail of this, a NAV-CARE program should it be brought to Newfoundland. I'm recommending that this volunteer-based program service individuals age 50 and older, and or an adult who is living with a level of frailty that has impacted their ability to complete tasks of daily living. I think the service should be low barrier, and older adults should not be subjected to an in-depth assessment process to access the service. It should be very much, an older adult presents looking for supports in any of the tasks of daily living or system navigation. It could be all or just one of those examples, and they could be matched with a volunteer based on the volunteer's interests and also the service that the older adult is looking to navigate or any kind of help that they want in their home. And I also want to point out that older adults that require assistance with lower level supports may also present as having complex needs. And what I mean by that is that an individual may require a bunch of seemingly simple fixes, but each fix requires connection to multiple different government organizations, nonprofits, or further logistical planning, through documentation. They might need to print off some documents and not have access to a computer or telephone. Transportation is also a barrier. So combined, all these seemingly simple fixes can be extremely overwhelming for somebody who has limited support or access or knowledge to any kind of other, knowledge to any existing programs and other barriers as well. So I think a volunteer is a great way to fill that gap and assist. I'm going to touch briefly on my research method. I started with a research question. How can volunteer-based services offer support that assist older adults to age well in their home? And I'll just briefly touch on some search terms that I included. I have them all listed here, but I started just, searching up system navigation support, healthcare system navigation, of course, Nav-CARE, caregiver burden and burnout, volunteer-based programs related to older adults, and volunteer management. I also wanted to look at some impacts of social isolation, especially with the current pandemic. And also wanted to research some vulnerable groups and geographic-based concerns as well. I also reviewed some local programs, reports, and policy reviews relating to older adults, so I can get an idea of the Newfoundland context. And I also did an environmental scan of current supports, which I kind of just touched on there, that have a system navigation component, just to see what we have currently as a province. And to summarize my research findings, I was able to narrow it down to 4 categories. What we know about system navigation, carers' experiences navigating formal support systems, addressing loneliness through social prescribing, and volunteer management and social work practice. So there are my 4 categories that I based the literature review on with regards to research. So what we know about system navigation, I'm just going to briefly go over some of the articles that I included in my literature review. So Manderson et al., they published an article or research systemic lit review that examines effectiveness of navigation rules that support chronically ill older adults and their transitions through the healthcare system. And these navigation roles were all formalized navigation roles with healthcare professionals, so nurses, social workers, case managers. There was 9 navigation models that were examined, and of the 9, 5 reported economic benefits, 2 reported psychosocial benefits, and 5 reported functional impacts to the patient. So, quality of life and capabilities were improved because of the system navigation support. These authors also note that older adults desire to stay in their home despite the declining health. And that, of course, most healthcare costs are incurred later in life. So the authors point out that this population is an important target group to ensure that appropriate programming is in place to reduce overall costs to the healthcare system, but also to support this population who, of course, as all of us are going to age, and typically as we age, there are more health conditions that are presented and certain levels of frailty as well. So of course, it is a target group that needs to be serviced appropriately. Another report that I reviewed was the Health System Navigators, a Band-Aid or a Cure. And this was published through the Change Foundation and informed by the reflections of their Panorama panel. So this is a panel of 30 Ontario patients and caregivers who are drawing on their own experiences, both good and bad, moving across the healthcare system to improve everybody else's experience. So I'm just going to point out some of the key findings. The report mentions both the challenges and benefits of navigation programs. And the article does examine specifically healthcare system navigation programs for people living with cancer diagnosis. And they have noted some benefits, improve recognition of barriers and possible solutions, improve coping skills, and an important source of emotional, informational, and logistical support for individuals. The article also notes benefits of navigation programs for the healthcare provider and the healthcare system. One of which is, having navigation programs highlights larger systemic struggles and issues within their actual system, and it improves the satisfaction of the care provided. Challenges noted related to a system navigator role would be ensuring that the role is receiving appropriate training. and lack of role clarity when navigators are integrated into healthcare teams. So that was some of the challenges that were noted. I think a really good quote that I hauled out of this article is that, you know, we require healthcare systems navigators because it stems from a system of care that is not overly accessible and well organized. So that was really good insight from the Ontario panel that I wanted to note here. And the panel of patients and caregivers also provided mixed reviews regarding the role of a systems navigator. So some of the panel members who were for this position, they said that it would be helpful for those with complex health conditions, individuals having trouble advocating for themselves, individuals with geographic limitations, and communication and language barriers. Some of the panel members that were skeptical about navigator positions noted that it might add to more of the bureaucracy in healthcare systems, and that the healthcare system should really focus on communication and communicating the roles of existing staff. So that was a good point as well to note. And the panel members did discuss different navigation roles. So they talked about more formalized positions, but also volunteer peer support system navigation as well. Lastly, in this section, Funk 2019 published an article highlighting that system navigation work should be a public responsibility and not a private struggle. And Funk outlines 3 ways to improve systemic navigation struggles experienced by informal caregivers and service users. And they are providing better information about available services, creating more formal navigation supports, and improving service integration. And this study also suggests that nonprofit volunteer system navigators can provide a more objective approach when aiding in system navigation as opposed to a formalized navigator within the healthcare system. Because nonprofits can focus more on the goals of the patient or family if they are separated from the healthcare system. So that was a point I wanted to know. And also, Funk outlines that there are economic benefits. The focus on system navigation highlights, you know, it amplifies social and health services, and it helps older adults stay in their home longer, prevents caregiver burnout, and allows family and caregivers to focus on other needs. So I just wanted to point that out as well. CARE's experiences navigating formal supports is another topic that I highlight in my literature review. And Funk et al. 2019 studies CARE's experiences navigating formal supports and highlights 3 forms of navigational support. Learning about services and resources, trying to access these services, and coordinating and overseeing a smooth and effective access to these services. So the caregivers in the study noted concerns about the less advantaged carer, struggles with accessing services due to rigid policies and bureaucratic procedures, and formal service providers failing to make appropriate referrals. So there were some struggles that the caregivers in that study had noted. The authors also discussed the emotional labor associated with being an informal caregiver. You know, for example, feeling frustrated, exhaustion, guilt, and feelings of being overwhelmed. And the data collected suggests that the current processes for accessing formal support on behalf of their loved one heightens the caregiver's burden on a structural level. Strateger et al. 2011 published a study that examines the interpretation of family caregiver empowerment through the lens of leaders and managers in the home care support or the home care system in BC. Oh, sorry, my video went. I didn't even realize. Sorry about that, guys. So this author published a study examining the interpretation of family and friends caregivers through the system leaders, so from their perspective. So through interviews with leaders and managers, the study outlined that some participants felt self-empowerment meant that clients and their carers are as independent as possible despite the lack of healthcare resources. Some participants noted that they feel empowerment can happen when formal support systems value the importance of educating families about resources, but also not overwhelming the families with too much information. So you want to strike the balance of engaging families in decision making, and also the older adults' voice in decision making as well as a method of empowerment. But the article also notes that different caregivers have different boundaries to how how they want to care for their family and what they're willing to do. So to assume and unload, I guess, too much responsibility on caregivers could cause feelings of anxiety and dissatisfaction with the formal support services. Okay, there we go. The next section that I talk about is addressing loneliness through social prescribing. So loneliness and feelings of isolation can be attributed to several adverse outcomes that impact physical health and well-being, lower quality of life, and increased visits to the emergency room, and increase the likelihood of long-term care admissions. So social prescribing aims to enhance these social connections to be used using an adaptation of the medical model whereby medical professionals actually prescribe practical supports such as social supports to treat conditions such as loneliness. And these examples can be cooking classes, music and dance classes, art-based programming, and food security services. And I just wanted to note under this section too, some COVID-19 considerations, because in my lit review, I also talk about the psychological impacts of this current pandemic. And I want to point out that, people with underlying health conditions, those with low socioeconomic status, and the elderly are at an increased risk for loneliness, but particularly when working through and dealing with a pandemic. That can cause heightened levels of anxiety, depression, and stress, just even leaving the house because you're afraid you're going to contract the virus. So then, of course, you're worrying about how your basic needs are going to be met. How am I going to get to the grocery store? How am I going to, if you're relying on public transportation and possible exposure risks there. So, I just wanted to make that connection as well and consider the COVID-19 implications. I'm really going to briefly touch on this section here about volunteer management and social work practice. In my lit review, this section refers to a lot of different tables talking about different methods for volunteer management and social work practice. So I wanted to make the connection though between the two because social work and volunteer management, they're very connected based on the helping nature of volunteers and the individuals that volunteers and social workers are servicing. So oftentimes you see social work practice being volunteer management. So I just want to touch base briefly on the universal and contingency methods that I read about with social workers and managing volunteers. Basically, the universal model is a one-size-fits-all approach. It kind of talks about the necessities that you need to run a volunteer program, planning and administration, volunteer work design, recruitment, screening, motivation and recognition, record keeping, and risk management protocols. And also, Stutter 2016 discusses formal versus, actually, I want to go back to contingency methods. Sorry about that, I skipped over that. Contingency methods, the authors, Brodney and Majai, argue that, universal methods alone, they kind of lay the foundation for volunteer management. But to best manage volunteers, you got to recognize that things change from context to context. So the contingency method accounts for that contextual change with volunteers, depending on, the services that they are providing. And under the contingency method, they consider volunteer focused methods and models, and organizational focused methods and models. So there's lots of different charts that I refer to in my lit review. And if you want any kind of resources sent, my email is going to be at the end of the presentation, and I can definitely share those. Yeah, so moving on to Stutter 2016. They discuss, or the author discusses, formal versus interactional volunteer management. And this is really similar to the two methods that I touched on just then. Formal is basically, the universal methods, and you look at best practices. And interactional considers volunteers' interactions with their peers, their paid staff, with the organization and the organizational stakeholders. And this author advocates that volunteers be given a strong strategic position within the organization so that there is sufficient authority to negotiate volunteer management resources, strategic commitment, and stakeholder interests. And lastly, this Roger and Funk article offers additional insight because they study volunteers' lived experiences when they volunteer within health organizations that rely on volunteer services to supplement the formal support that older adults receive in a residential care facility. But one of the key findings that I found from this article was that it's really important to strike a balance between having policies that manage risk and liability while also valuing volunteer autonomy. So this article talks about how volunteers want to make a difference and they want to create meaningful relationships with the people that they're working with. But they also want to feel protected as well. So it's kind of striking that balance that you don't want to disempower volunteers because you have too rigid policies and risk management protocols. But you also need to give volunteers space to be advocates and have meaningful work. So I wanted to highlight that as well. So all this research, I kind of reflected on it and thought about what would be the implications to the development of a Nav-CARE program in Newfoundland. And one key implication, I think, is that we need to focus on servicing older adults in rural and remote areas. I think it's a big factor to consider in Newfoundland because the population of older adults in the province is increasing, particularly in rural and remote areas. And that was highlighted in some of the NL context reports that I was reviewing as a part of my research. And rural and remote areas of Newfoundland do experience limited access to programs. So it's important to acknowledge this as a challenge when you're creating a volunteer-based program that aids in system navigation. One thing that I thought about is that, COVID-19 and social distancing practices have proven that it is possible to provide volunteer support from a distance, depending on the needs of the older adult and what they're looking for. So for example, if the older adult is looking for friendly visiting, we've seen that some friendly visiting programs have switched to friendly call programs. So if the volunteer is still based in, urban area, but is matched with an older adult in a remote area that's looking for that type of support, then that can be offered. Another thing I thought of is, when the volunteer coordinator is working towards recruitment strategies, they can partner with existing volunteer groups that already are existing within those rural and remote areas. And then the volunteer coordinator can provide that support from a distance to the local on-the-ground volunteers. We're using Zoom now and can meet and support the volunteers that way. If the volunteer coordinator was based in an urban area, but the volunteers were actually stationed in their community. So there's some recommendations that I have and some ideas that I thought of to try to meet that need. Volunteers can assist both the caregiver and the care receiver. So as a part of my research, I also read a stat that 1/4 of older adults aged 65 plus in Canada are providing a caregiving or are a caregiver, to a loved one with a long-term health condition, a physical and cognitive disability, or a condition related to aging. And the same report noted that 31% of senior caregivers caring for care for their spouses about 30 hours or more a week. So having this volunteer, it can fill a gap for people who don't have a current caregiver, but it can also support caregivers in their role as well. Volunteers can offer support in conjunction with home support workers. So I don't think it's, oh, you have home support, okay, well, you don't need a volunteer. I think that the two can work together because they're doing and servicing different needs for the individual. So that was an important, I guess, learning that I found when I was reflecting on the implications of the development of Nav-CARE. Also, volunteers can support social prescribing activities as a method to improve physical and psychological wellness. So a volunteer, depending on what the older adult is looking for and what type of support, could help with transportation to some social events. Could be an opportunity for intergenerational activities and social events that way. And sharing of ideas and that type of thing. It could also be, the volunteer and the older adult can attend events together. So I think that this is a good opportunity for volunteers to be used for those type of activities to address loneliness and isolation. And also I kind of touched on this in the last section, but the organization responsible for implementing Nav-CARE in Newfoundland must value and support volunteers through the organizational culture and the paid position of a volunteer coordinator. I think this is really important because volunteers are going to be, in many cases, the first contact for the older adults that they're supporting in their home. So they need to feel like they are supported within the organization and valued. They need to feel like they have somewhere to go and consult with, if they have any questions or want to make any referrals or get further information. So I think the organization as a whole, but also particularly the volunteer coordinator, needs to focus on supporting volunteers and supporting their advocacy work. And lastly, I just want to clue up by kind of making the connection with Nav-CARE in Newfoundland and some of the ideas that I brought forward and the Health Accord. During my time here, I got to sit down and read some of the blueprints that were recently issued there in the last couple of months or a month or so. So I think this proposed volunteer program does align well with some of the ideas brought forward from the Health Accord. The Health Accord notes that the province has an aging population and proposes the means to support age-friendly communities and aging in place. And one focus in achieving age-friendly communities is to offer support that enable more seniors to stay at home. So I think that this program is, of course, focused on that. So I just wanted to highlight and make that connection. I also think that Health Accord NL discusses social prescribing and making the link between the social determinants of health and the healthcare system. And I think that this program could absolutely support that initiative. And throughout the Health Accord, you hear about navigation and into connecting community and the healthcare system, and I just think there's a lot of similarities there that I wanted to point out. So I just want to conclude by saying the implementation of Nav-CARE in Newfoundland can fill a crucial service gap in the province. It is my hope that this research will aid in any kind of future planning and development, and I would love to be a part of it. To ensure that Nav-CARE in Newfoundland is a fully informed service, though, I think it's really important for future program developers to collaborate and seek feedback from older adults themselves, advocacy groups, and also existing supports currently working to assist this population. I think that's key in developing an informed service. And I think that's a good segue into the discussion, because I'm currently cluing up the actual lit review document. And I would love to hear anyone's comments, suggestions, feedback, anything at all. I'm open to learning. And I have my email there listed. So if there's anything, research wise, I kind of tried to speed through it in the so we can meet the time requirement. But if you want any kind of additional information or my references and anything like that, anything at all, you can just email me at my Mon email there, vnp413@mon.ca. So yeah, I'm gonna open it up to anyone who has some questions, comments, or feedback.
Vanessa, going back, Susan has announced that Anglican Homes has a seniors wellness navigator on staff to support. And Krista, she said First Link professionals other than GP can apply to be referring partner as a community support social worker. She has referred many who are unaware of this resource as well. It's good that you mentioned it.
Oh, great, thank you.
Vanessa, that was absolutely great. It was a wealth of information, and you must have done a considerable amount of reading for during the literature review. It was a lot of information. Anyone have any questions or comments for Vanessa right now at this point in time?
I have a few comments. I'm hoping that everybody can hear me well.
No one?
Yeah, I can hear you.
Okay, can everybody hear me? Yeah, I'm Christopher Joy. I'm with Connections for Seniors. And Vanessa, I think it's a fabulous job that you're after doing. There was a number of things that I see that we're doing here at Connections for Seniors. However, it's more of an informal basis that we're moving forward with. But the fact that there's something there that we can implement province-wide, I'm certainly open to that, and hopefully we can, collaborate that in, future meetings. I'm just looking at, what I like about it is the volunteer peer support, how objectivity would come into the picture. They are there for their peers, and they want to ensure that the peer has adequate supports in the community, and they can offer that in a non-biased fashion. The volunteers that come into our program, my purpose is to engage and then to empower and to educate all volunteers, and also to relay that to the our clients that our volunteers are going to be matched with. And also, as you mentioned earlier, is the lived experience of the volunteers would go hand in hand with the clients that we serve. And I'm really excited how you segued into the health accord that was just released recently in the province, and how volunteer efforts can certainly enhance the lives of seniors in our community. So I'm really excited about everything that was presented here today, and hopefully as we move forward, we can have closer ties.
Yeah, that's great. I know the health accord, the blueprint. I mean, I had the lit review almost, a good draft done, and I seen the health accord blueprints, and I said, oh, well, that's really perfect timing. So I had to make that connection because there's a lot of linkages there.
Yeah. And Vanessa, what I realized with the health accord when it first came out, I mean, it said like over the last 40 years, I mean, I may be off a few years, but how much money was spent in healthcare, like 256% over the last 40 years, and like 6% of the budgets went into the social determinants of health. And yeah. I think, what we're seeing here today certainly fits into, the social determinants of health, and how that is going to benefit everybody as we move further into the future. I think it's a great presentation. I'm excited.
Thank you. Me too.
Vanessa, Gail Weidman, has her hand up. I think she'd like to speak. Go ahead, Gail.
Yeah.
Hi, Vanessa. Great presentation. Thank you. So for those who don't know me, I've been walking along this journey with Vanessa as her supervisor at the School of Social Work. So I know that that one of your early goals was to find a way to fill a gap that you had observed in your work with housing. And so I just wanted to have two questions. The first one is, so what do you see as the challenges So I think you've done a great job of outlining the opportunities that NAV-CARE presents. What do you think are the challenges of rolling out NAV-CARE in our province?
I think one of the challenges will be how to roll it out outside of the St. John's metro area, and really service seniors in the rural and remote areas. Yeah, because I think if there's already a volunteer base within a community, then that's a good connection to kind of get an in and already tap into that. But if there's not a whole lot of volunteers already in the community and accessible on the ground to, say, an older adult that's living there, it's going to be hard to try to match someone to fill that need. I mean, it's one thing if they're just looking for friendly, a friendly chat and that type of thing. But if they're looking for services in their home, I think that could be a challenge for sure. And because there's only so much you can do virtually. So it would be great to somehow come up with a recruitment method across the province for volunteers.
So one of the things that anybody who's done any work in volunteer development over the last decades has heard a lot of is this question of why should volunteers be doing the work of that healthcare services should be providing. So how would you answer that question? What is the role of the volunteer within the healthcare system? Like, what do you think needs to be done to sort of elevate that role?
I think training is important for the volunteers to have like a baseline of, this is the region you're going to be volunteering in. Here's what's available from region to region, especially if you want to service rural and remote areas. You need to have a knowledge of the limits and also what's there. I think the volunteer could act as a good first point of contact because they're on the ground, they're having those discussions and making that relationship or building the relationship with the older adult. But I think the volunteer coordinator would probably act as more of like a mentor role and a coaching so that the volunteer feels like, well, okay, I just stumbled upon this question. I don't know how to answer it. How can can we set up a meeting and discuss this scenario? What kind of services can I offer and how can we take it any further? I don't think it's reasonable to expect the volunteer to know everything, but just to be there and be that, companion and that support and ask the questions to the volunteer coordinator who can help put them in the right direction.
Great presentation, Vanessa. Thank you.
I wonder if all the move now towards age-friendly communities would that could play a definite role in this. I was just looking at, actually just this morning, I had some information came in from the UK, and they're talking about Wales. Okay, and they have a strategy for an aging society they've just developed in Wales. And it has 4 aims: enhancing well-being, which includes supporting unpaid caregivers, improving access to health and care services, improving access to mental health services. Then they talk about building and adapting homes that suit people as they get older, and a lot of things that would help meet the basic needs of seniors as they age. And I think that's something to keep in mind when we start talking. And actually now in September, we are going to have a presentation on age-friendly communities, and I can see that momentum building from there.
Yeah, absolutely.
Any other comments or questions for Vanessa?
Hi, it's Charlene Taylor. Vanessa,
Hi,
I just wanted to say, Vanessa, what a fabulous presentation that was. And my heart always has a special place for you and everything that you do, because I know that your passion is in the area of seniors. So I'm just so excited for the work that you've done. This is something that's really needed in Newfoundland, whether it's in rural areas or, urban areas or whatever the case. I mean, Vanessa, as you know, many of the people that we deal with, even we have 9 buildings in the St. John's region. And those 9 buildings house a total of, I think it's 212 and change in terms of the number of people that are there. And oftentimes people don't meet the requirements for the community supports program. They don't have family or friends. They don't have phones. They don't have internets. You know, they're very much at risk. So to see something like this, and you know, I'm so glad that Gail was with you along your journey. And one of the challenges that I would see would be volunteers. You know, getting volunteers, screening volunteers, liability issues, you know, that kind of stuff. But at the same time, I'm just excited about the prospect of something like this, because having this kind of volunteer support, regardless of whether it's, you know, taking someone to an appointment, getting a prescription, picking up groceries, you know, we're doing something for someone who's otherwise not able to do it. I think it's very, not only liberating, but it helps people age safely in community. So anyway, that was my just long-winded comment, but I'm so excited. I can't wait for you to come back to housing and bring some of this stuff back to us. And good on you.
Thanks, Charlene. And no, and it's a good point, because it's preventative too, right? People just need, you know, a little bit of help, but this little help goes a long way, because all it takes is someone to, you know, just need a little bit of support, but it's not there. And then there's a slip and fall, and you know, then you're declining in health, and actually, you know, could be in hospital or anything at all. So any kind of support in-house, like, you know, like we were chatting about, I think is preventative too.
Vanessa, Rick Singleton has his hand up.
Oh.
Go ahead, Rick.
Hi, Rick. Sorry about that.
Yes, great, Vanessa, great job, and congratulations to you and Gail for supervising good product there. I had a few comments there, type in about, you know, 3 years that I've observed in having done work with volunteers over the years and being a volunteer myself now, are the recruitment, which includes the screening and orientation and training and what have you, retention plans. You know, what do you do to keep people? So often I've seen good volunteers come and go because something happened along the way that didn't allow it to be to achieve the fulfillment or the joy or whatever it is that the person wanted to bring to the organization. And I think linked to that is recognition. But from the bit of discussion on the go here, one thing crosses my mind. I was on the committee on aging for the health accord stuff. So an observation I had from many presentations and readings that we did is that, you know, so much of the predicament of our healthcare system relates to the lack of regard for scope of practice of other professionals. But in my years in working in the healthcare system, I observed a real significant problem with the lack of regard, if we were to call it scope of practice, or for what does the volunteer bring into this organization. And, you know, I think a component of the implementation of good volunteer programs is that staff, frontline staff, have an awareness of what volunteers are doing, that they're not just to be plugged in to do something that I or we as professionals don't want to do, that it's a significant role. And, you know, perhaps the lingo that we need to bring to it, at least for those who are going to be hands-on, cheek to jowl with patients, clients, residents, and so on, is a description of what the roles and functions are in kind of the context or format or the lingo, to use that word for it, of scope of practice. What is the scope of practice of a volunteer who's going into the home to take someone out for a walk or to spend time with them or to support them in their loneliness or whatever the case might be. Anyway, great job, Vanessa. Thanks for provoking so much thought and reflection and involvement. Look forward to seeing it being brought on a bit further by you and Gail and others.
Thanks, Rick.
Vanessa, Meg has her hand up. Go ahead, Meg.
Hey, Meg.
A great presentation, Vanessa. One thing, it's a rhetorical question because I'm not expecting anyone to answer it, but one of the things that comes to mind for me in something like this that might be the largest challenge, and I think about it all the time as a peer support volunteer as well, is the people, the invisible people. The seniors we don't see, the seniors who don't raise their hand, who might have some of the greatest need. And I always worry the most about them. And I'm just parking that out there in the context of this entire thing, because finding and helping them is probably most significant, because they don't raise their hand, but somebody knows them.
Right.
Yeah. So I'm just parking that.
No, it's a good point though, Meg. I think that should a program like this be developed, there needs to be major awareness brought to it, and clear about the role and how a volunteer can help. I do think too, and the type of people that you mentioned, you know, that have fallen through the cracks and don't raise their hand and don't ask for help. If they're connected to a service provider, they might be more susceptible maybe to volunteer support versus a formalized support. Because I think there's a little bit of a different dynamic there. Like volunteers are people that are choosing to spend their time unpaid to assist people, and I think the dynamic is just different. And I think that, you know, maybe those type of people might be more susceptible to that.
Yeah.
Yeah, just a thought in here.
Caitlin, Vanessa, there was a comment from Caitlin. She said, great presentation, Vanessa. Who are the volunteers currently in the BC area? And are they usually younger or older adults providing this volunteer service?
When in my reading, I never seen a major trend. I did see that some people were, some volunteers, I think one of the articles said were retired social workers or retired nurses, like retired people that work within the healthcare system, but I don't know if that's a trend, or if that was just noted in the article. I think it's a good opportunity to have both older adults as peer support, you know, but also I think that younger could be an opportunity for intergenerational relationships too. Oh, Gail?
I was just going to say, but Vanessa answered the question probably better than I could. So there is a wide range of ages of people who are currently volunteering with NAV-CARE. The key is that there is the training and support provided with this program, so that it really does enable that you know, various people from various backgrounds to participate. But also to Meg's question, important question about the hard to reach older adults. I think that another benefit of a sort of more structured volunteer support program like NAV-CARE is that it provides that sort of step away from that more objective kind of evaluation of concerns. So for example, in lots of rural and remote communities where people know everyone, there are people who in those tight-knit communities, there might be a reluctance to reach out for help, because we know people. We don't want people to be sort of up in our business, as they say. So then this kind of volunteer program provides that sort of arm's length, sort of in the literature, we call it intimacy at a distance, sort of that ability to reach out, because it's not family or friend or maybe neighbor, but it's also not a formal provider. It's somebody in between, or what we call intermediate supports, that provides that link without that sort of discomfort of having somebody that we know really well providing that the kind of support we're looking for, or questions that we need answered. It might not be a sort of hands-on support. It might just be a question that we need answered. I know that and Elizabeth Siegel's here, and she can answer this question better than I can, but when we were working on programs to address elder abuse in rural Newfoundland, we talked about systems navigators in that role as well. And it was somebody who could connect us to the services that we need. So yeah, so I think it's that level of support. It's not formal, it's not family, it's some kind of, you know, a more objective, as Christopher is saying, it's a more objective kind of oversight of the program.
Vanessa, there was a comment from Tammy. She says, you mentioned outside of St. John's. She works in the Eastern Health Rural Community side and oversees the Eastern Regional Wellness Coalition. And she says they have 6 in the province, and they are connected and work with so many senior type of volunteer groups who are promoting wellness in their communities. They are the movers, they are the shakers, and are always creating or looking for opportunities to connect and support to older adults in their communities. And they are doing so much work that often goes unnoticed.
Wow, that's great. I think if we could, I'm glad this is being recorded so I can refer back to that, because that's a really great organization. I should do some more reading on. That's awesome. And what a great way for NAV-CARE NL to support these volunteers that are already doing the work in the communities through a volunteer coordinator. Well, I think Christopher Joy, do you have your hand up? Oh, maybe not.
Okay, can you hear me?
Yeah.
No, I'm just, the volunteers that we have recruited here with Connections for Seniors, some of, I like the objectivity that they come, they have nothing to lose. They'll go into the home, they'll see their peer, they'll discuss with the peer, any pressing issues or current issues, and they can just have a fresh look at the situation, and then they come back to me, and they're looking for direction, and I am to a certain extent able to provide that direction to the volunteer, and they go back to their peer, and it's just a breath of fresh air when it goes back to the peer that we can provide this service or we can provide this referral. And but again, I just want to focus on the objectivity that the volunteer brings to our program.
Yeah, absolutely. And they have knowledge and experience too to share. So,
They have lived experience.
Yeah, exactly.
Mm-hmm.
Any other questions or feedback that I'm trying to scroll through the chat, but I don't want to skip over anybody.
There's a lot of comments in chat saying, thank you, Vanessa, great presentation, great information.
Well, thank you. Thanks everyone for coming. And yeah, I'm just clearing up the actual document now. So this is really great for my learning too. And some other things maybe to consider when I'm finalizing my review. Oh, Gail.
Yeah, this question is, I guess, for the group. So where do you think we go from here? What do you think are next steps for this kind of program, or just general support to volunteer programs in Newfoundland and Labrador?
Well, I'm certainly on board to move forward with any recommendations. I'm always looking for ways to better improve our services that we have. And I'm certainly going to be in contact with Vanessa shortly, just to share information and just to see what components we can include with our existing program.
Mm-hmm.
Great.
Yeah.
Thanks, Christopher.
I put this comment in the link, Vanessa, but I just I think there are so many great programs already existing, both formal and informal, in Newfoundland and Labrador, and I really see the volunteer network as being the way to coordinate those programs and link them to older adults in an individualized way, so in a way that makes sense for them.
Yeah, for sure.
Thanks again. Great presentation.
Thank you, everyone. Thanks, Gail. Oh, Elizabeth had a comment too. Obtaining funding for paid volunteer coordinator is key, and perhaps this will come with the health accord. Yeah, that would be great.
Thank you, everybody. And I think among you, you've given Vanessa a lot more to think about after she finishes today's presentation. It was great, Vanessa. Thank you for taking the time to talk with everyone today. And as for our participants, if you attend this session as part of your professional development. We do issue certificates, and hopefully we'll get them out within the next couple of days. And that would be fabulous. And anyone interested in being a friend of Seniors NL, and that's to link older adults who have questions or concerns about any programs or services that they don't know exist, or any kind of information, just get in touch with us. We will give you business cards, and you don't have to know all the programs and services yourself. But if you hear someone, run into someone who is wondering about home support or income taxes or anything at all, and just pass them one of the business cards. Your name would be on the front, and on the back would be our information, our contact information, so that they can just call us, and we will give them the information they need. If we don't have it, we will do everything we can to find it, and we'll get back to people. And so watch for our new series of Tuesday morning information sessions starting in September. This was a special one today because it was Vanessa. And anyway, in September, we will start our regular weekly sessions again. And I certainly hope to see more of you there. We will be releasing some of the invitations as soon as I've got speakers finalized, the dates finalized. So again, everyone, thank you very, very much. It was great seeing you. And we will be sending out the link to the YouTube recording of the session, as well as any of the comments or the information that was shared in the chat boxes. And of course, Vanessa's slides. So thanks everyone, and enjoy the rest of your summer.
Thank you, everyone.